We are so excited to announce the newest sponsor of the Success NP podcast. Picmonic is a quick and effective aid to help you pass your NP boards. They utilize 2-minute videos that connect difficult to remember facts with unforgettable characters. By tying facts together into ridiculously memorable stories, you'll be able to retain the information for test day. They help reinforce what you learn and track your progress with thousands of built-in rapid review multiple choice quizzes. The use of the intelligent space repetition algorithms automatically adjust to your learning needs, so you'll be reminded to review the right information at the right time, increasing long-term retention. Picmonic is also integrated into the True Learn question bank, so you can study exactly what you need and test your knowledge. Check them out today if you're preparing for board. Link in the show notes. Attention, all nurse practitioners and NP students. Are you tired of feeling the disconnect between clinical rotations and didactic teaching? Say hello to Success NP's clinical booklet guides.
As NPs ourselves, we know how valuable it is to have a resource that helps bridge the gap between clinical and class. So we created the digital resource to do just that. Our clinical booklets cover 5 major NP tracks: psych, adult, peds, family, and women's health. Success NPs wants to create tools and provide support NPs need to thrive in their careers.
So why wait? Check out our Success NP Etsy shop, linked in the show notes, for our digital guides and other digital clinical resources.
Welcome back to another episode of the Success NP podcast. I'm your host today, Jackie, and I'm excited because today's case study is right in my wheelhouse. It is OB-GYN. It's been everything I've done since I became a nurse, and so I'm super excited about today's case study. We're going to be diving into the postpartum world. It's a space full of rapid physiological changes, healing, and sometimes hidden complications. Today's case is going to be a postpartum mystery that might look like a typical recovery issue at first, but as we peel back the layers, something unexpected is going to emerge. Can you figure it out before the end of the episode? Let's see. Let's step into the story of Maya. Maya is a 29-year-old first-time mom. She had a scheduled cesarean section 2 weeks ago after a long stalled labor. Baby girl was born healthy. Her surgery was reported as uncomplicated. She was discharged on postpartum day 3, which, if you know OB, that's pretty typical for a regular cesarean section to be discharged on postpartum day 2 or 3. So now she's in your clinic and you're the nurse practitioner seeing her. She's complaining of abdominal pain that's not getting any better. But as you begin to listen to her story, you realize there maybe more to uncover than just typical recovery. Maya describes her pain as a dull, aching pressure low in her pelvis. She says it's worse when she's sitting up or standing for long periods and is not well controlled with ibuprofen. She also reports mild intermittent fevers, the highest being 100.8 degrees Fahrenheit last night. She has some mild foul-smelling lochia, which she assumed was normal. She's breastfeeding, feeling tired, and describes, quote, a weird fullness in her lower belly. You dig a little bit deeper into her pregnancy. Maya tells you that she had gestational hypertension that started around 35 weeks. She was managed conservatively, but her blood pressure was trending up and she had significant lower extremity swelling towards the end of the pregnancy. At 39 weeks pregnant, she went into spontaneous labor, but after 24 hours with no cervical change, she did undergo that cesarean section. She also mentions that during her hospital stay, she needed a blood transfusion after her hemoglobin dropped postoperatively. She doesn't recall the exact numbers, but she does say she was feeling dizzy and lightheaded. She denies urinary urgency or dysuria. She denies chest pain, shortness of breath, or lower extremity swelling now. There's a few more variables on the board now. Let's go over her review of systems, kind of summarize what we just learned about Maya. She has no headaches or vision changes, no new vaginal bleeding beyond the normal lochia postpartum, no nausea or vomiting, some mild fatigue and night sweats, and increased tenderness with movement, especially when bending or lifting. So far, you might say these are all very typical postpartum, especially for a C-section, right?
I hate to interrupt a good conversation, but I have to tell you about the newest sponsor for the Success NP podcast. Picmonic is a quick and effective aid to help you pass your NP boards. They utilize 2-minute videos that connect difficult to remember facts with unforgettable characters. By tying facts together into ridiculously memorable stories, you'll be able to retain the information for test day. They help reinforce what you learn and track your progress with thousands of built-in rapid review multiple choice quizzes. The use of the intelligent space repetition algorithms automatically adjust to your learning needs, so you'll be reminded to review the right information at the right time, increasing long-term retention. Picmonic is also integrated into the True Learn question bank, so you can study exactly what you need and test your knowledge. Check them out today if you're preparing for board. Link in the show notes.
But we don't want to assume anything at this point. Let's get into her physical exam, kind of explore those vital signs, and go from there. We have a temperature of 100.6 degrees Fahrenheit in the clinic. Her heart rate is 94. Her blood pressure is 124/78. Respiratory rate is 16. And her O2 saturation, or room air, is 98%. You perform your physical exam. She appears tired but alert. On palpation of her abdomen, you note that it is soft but tender near the suprapubic. On palpation of her abdomen, you note that it is soft but tender in the suprapubic region. Her C-section is healing well. There's no erythema or drainage. Her uterus is firm but slightly enlarged and mildly tender. You note no adnexal masses, no rebound or guarding, and there's still just a trace of edema on the lower extremities near the ankles, but no signs of DVT, no signs of mastitis. Lungs and heart are normal. So you're still forming that broader differential. All right, let's just think about it for a second. What are a differential diagnoses? What could this be, right? You're the nurse practitioner, you're seeing this postpartum patient, and you're thinking, this could be endometritis, hematoma, retained products, a urinary tract infection, postpartum preeclampsia, a pelvic abscess, or something more of a surgical complication, adhesion, bowel injury. So you think about running labs and ordering some imaging. Your initial workup includes a CBC, a CMP, a CRP, a UA, a pelvic ultrasound, and in the back of your head, you're thinking about maybe a CT if that ultrasound is not quite clear. Results come back with a white count that's slightly elevated at 13.2, a hemoglobin at 10.9, which is low normal, especially considering she's postpartum. She received that recent blood transfusion. Her platelets are normal. Her CRP is elevated at 8.4, and her UA is normal. So you send her for pelvic ultrasound. Ultrasound results show a slightly enlarged uterus, no retained products of conception. But there is an echogenic mass with some posterior shadowing in the lower uterine segment near the incision site. So you decide to order a pelvic CT for further evaluation. While waiting on imaging, Maya mentions that she sometimes feels like a pulling sensation when she moves, almost like something is stuck inside. She also says she had a moment of dizziness this morning when standing up quickly. So as a nurse practitioner, you consult the OB. They agree, CT is appropriate. The CT results come back. The CT pelvis shows a well-defined, soft tissue density with internal air and radiopaque markings consistent with a retained foreign body, likely a surgical sponge. So your final diagnosis? Retained surgical sponge. Yes, guys, retained surgical sponge. It happens. Maya is referred urgently for surgical removal. She undergoes laparoscopic retrieval and recovers well post-op with antibiotics and supportive care. So, what did we learn from Maya's case? Let's go back because I think there's a lot to be said for this. Although a retained foreign object may not be your everyday scenario, we can learn a lot about her HPI and what that could mean for our differential diagnoses. So what? Postpartum pain that worsens or fails to improve absolutely needs thorough evaluation. Like, red flag, right? We should not be getting worse. We should be getting better, especially 2 weeks postpartum. A history of surgical delivery increases the risk for complications like hematoma, abscess, or retained foreign body. So the fact that she had that C-section, automatically those are going to be, some of your differentials right there. So our ultimate diagnosis of retained foreign sponge is rare, but is definitely serious. These symptoms are often vague and they mimic common postpartum complaints. Like I mentioned earlier, all of her symptoms, you could just say, she's postpartum, typical recovery, brush it off, which would be, of course, a huge mistake given what her ultimate diagnosis was. Imaging is key. If ultrasound is inconclusive or concerning, a CT can be invaluable. A history of pregnancy complications like gestational hypertension and postpartum anemia can cloud the picture and making it even more critical to stay open-minded. So, of course, given that her pregnancy was complicated with the aforementioned conditions, we're automatically going to think maybe it's related to that. We do want to take everything that the patient tells us into consideration, but we need to make sure not to narrow our vision and always stay with that broad differential until we get more information clinically. All right, guys, I hope you enjoyed this quick but super fun case study with me. I always enjoy going through these with you. They're honestly my very favorite. And I would love to hear, especially given that I'm in the OB-GYN realm, if you have any postpartum puzzles or surgery-related stories even, you can DM us on Instagram at The Success NP. Give us a follow. Give us any ideas that you want to hear about. We'd love to hear back from you. Just give us a little feedback. And don't forget to check out our clinical guide at successnp.etsy.com or on our website. Until next time, stay curious, stay sharp, and we'll see you soon.
Thanks for tuning in to another episode of Success NP. We hope today's discussion has shed some light on the diverse career options or taught you how to improve your clinical practice as a nurse practitioner.
Remember, whether you're considering a specialization, pursuing advanced certifications, or exploring non-traditional roles, there's a wealth of opportunities out there waiting for you. Be sure to subscribe to the show so you don't miss an episode and leave us a 5-star review. It helps the podcast grow. The Success NP's podcast is on the World Wide Web, YouTube, Instagram, Facebook, and X. So subscribe to our newsletter for updates on new podcast episodes and other information to help you on your own NP journey. You can always message us at successnpspodcast@gmail.com with any NP podcast episodes or topics you'd like us to discuss.
Until next time, take care. Stay curious and keep advancing your careers as a nurse practitioner. And just a friendly reminder, the information on this podcast is for educational purposes only. The information should not be used in substitute for professional care by a medical provider. The information on this podcast does not represent medical or professional advice or services.
Bye for now.